A, B, C, D. So someone in fluid volume overload. So this is going to be someone who has kidney issues or congestive heart failure. Airway, they're going to have frothy secretions. Breathing, they're going to be dyspnea, so they're going to be short of breath. Tachypnea, so increased respirations, and probably bilateral rales for lung sounds. Circulation, blood pressure, and pulse are going to be up. Central venous pressure is going to be up. They're going to have pounding, 4+ pounding pulses, distended neck vein, and pitting edema. So this is fluid volume overload, pitting edema. So airway, breathing, circulation. D is debrain. They are going to have change in mental status. And then, what are we going to do? Someone in fluid volume overload, what position do I want them in? Yeah, so if it's contributing to increase intracranial pressure, I want them in low Fowlers. But otherwise, if it's respiratory, which most of the time it is, it's semi-Fowlers to Fowlers. All right, so IV, yes or no?
No.
No. If I have an IV, I am going to question. They're already in fluid volume overload. As far as their labs, they're going to have decreased sodium, and they're going to have decreased urine-specific gravity. And what is treatment? So, am I going to give oxygen? I meant oxygen. Yes, so I want oxygen. And then, what's my treatment of choice? Diuretics. So, treatment, diuretic. I want to monitor INOs, daily weights, listen to their lung sounds, and check potassium. Once they're on a diuretic, I want to check potassium. But fluid volume overload, just from those A, B, C, D, you should be able to answer most questions. All right, so nurse assessing a client in an outpatient clinic. Which client statement alerts the nurse to possible left-sided heart failure? Before I go any further, left-sided is what? Lung. Right-sided?
Systemic.
Yeah, I say left side lungs, right side rest of body. So you're systemic. So A, I have been drinking more than usual. B, I've been awakened by the need to urinate at night. C, I have to stop halfway up the stairs to catch my breath. D, I have experienced blurred vision on several occasions. So which says breathing issues with left lung? C is correct. So manifestation, left-sided heart failure, crackles, wheezes, breathlessness, pulmonary congestion. Okay. The nurse assessing a client admitted to the cardiac unit. Which statement made by the client alerts the nurse to possibility of right-sided heart failure, so the rest of the body? I sleep with 4 pillows at night. My shoes fit really tight lately. I wake up coughing every night, or I have trouble catching my breath. B is the one rest of the body. Everything else is connected to the lungs. The client asks the nurse why it's important to be weighed every day if she has right-sided heart failure. The nurse's best response is A, weight is the best indicator that you are gaining or losing fluid. B, daily weights will help us make sure you're eating properly. C, the hospital requires that all patients be weighed daily. Or D, you need to lose weight to decrease the incidence of heart failure? A is correct. So now how many pounds of weight gain are we concerned that we're going to call the doctor daily?
2 to 3.
2 to 3. How much over a week?
5.
5. Very good. Nurse is administering captopril to a client with heart failure. What is the priority intervention for this client? Administer the medication before meals to aid absorption. B, instruct the client to ask for assistance when arising from bed. C, give the medication with milk to prevent stomach upset. Or D, monitor the potassium level and check for symptoms of hypokalemia. So what type of med is it? ACE inhibitor. What do we give ACE inhibitors for? High blood pressure. So it's not a diuretic. I'd get rid of D. So now, so they say before meals with milk, they're almost saying the same thing. Well, the food's going to aid or it's going to prevent stomach upset. I know my NSAIDs do the stomach upset. Never really heard of captopril, so maybe I'd stay away from that. But it does bring down the blood pressure. My big concern is it's going to bring it down, leading to orthostatic hypotension. I'm going to ask for assistance when getting them out of bed so they don't faint on me. So B is correct. A client has been admitted to the acute care unit for exacerbation of heart failure. What is the nurse's priority intervention? So again, this is exacerbation, assess respiratory status, monitor electrolyte level, administer IV fluids, or insert a Foley catheter. A is correct. So exacerbation of heart failure, my biggest concern is AB, airway breathing. So I'm going to assess that respiratory status. The nurse caring for a client with mitral valve stenosis. What clinical manifestation alerts the nurse to possibilities that the client's stenosis has progressed? So mitral valve stenosis, what are some of the signs and symptoms? So how would I know the stenosis has progressed? Oxygen saturation 92, dyspnea on exertion, muted systolic murmur, or upper extremity weakness. What is it? B is correct. So fatigue, hemoptysis, and dyspnea on exertion are usually some of the first symptoms that you may see. With the stenosis, you possibly could even have pulmonary venous hypertension. But again, that fatigue, hemoptysis, and dyspnea are key symptoms. Let's see what else I have here. A client who's had a prosthetic valve replacement asks the nurse why he must take anticoagulants for the rest of his life. What is the nurse's best response? The prosthetic valve placed you at greater risk for a heart attack. Blood clots form more easily in artificial replacement valves. Or the vein taken from your leg reduces circulation in the leg, or the surgery left a lot of small clots in your heart and lung. So why do they take anticoagulants? B. So because of the artificial valve, blood clots form more easily. So other things that someone on a artificial valve, precautions, discharge that would need to tell them, do some teaching. What is it? So antibiotics prior to dental procedure, absolutely. So antibiotic prophylaxis is necessary for all dental procedures. Let's see, and that is, so for rheumatic heart disease, what's the common cause of rheumatic heart disease? Common cause. Infection, what type of infection? Strep. So strep causes rheumatic heart disease, again causing rheumatic endocarditis. So really someone who has strep infection needs to take care of it as soon as possible. The nurse discharged the client home following a mitral valve replacement. What statement indicates the client requires further education? So which one of these is a concern for us that we need more education? A, I will be able to carry heavy loads after 6 months of rest. B, I will have my teeth cleaned by my dentist in 2 weeks. C, I will avoid eating foods high in vitamin K like spinach. Or D, I will use an electric razor instead of a straight razor to shave. Which one requires you to do more teaching? C is, no, I'm not gonna, that's okay. I don't want them to eat hot food high in vitamin K because it's gonna reverse the Coumadin. Okay, vitamin K is an antidote. To eat a small amount to be consistent is fine, but eating high doses, that's correct. But one of these is incorrect. B. I will have my teeth cleaned by a dentist in 2 weeks. That's going to prompt me to do further teaching because they need to have prophylactic antibiotics. Everything else is okay. How long should they avoid raising their arms in heavy loads after any type of cardiac surgery?
6 to 8 weeks.
So it's usually somewhere around average about 4 weeks. You know, maybe for some a little longer, but usually it's about 4 weeks. So 6 months, they're fine to carry, so no issues there. So B is the right answer. A client with pericarditis is admitted to the cardiac unit. What assessment findings does the nurse expect in this client? So again, with pericarditis. Heart rates, it speeds up and slows down. Friction rub at the left lower sternal border. Presence of regularly galloped rhythm or coarse crackles of bilateral lung bases. B is correct. That friction rub is with pericarditis. So B is correct. Let's see. Okay. Nurse providing discharge education to a client with hypertrophic cardiomyopathy. What priority instruction should the nurse include? Take your dig at the same time every day. 2, you should begin an aerobic exercise program. C, you should report episodes of dizziness or fainting. Or D, you may have only 2 alcoholic drinks a day. So hypertrophic cardiomyopathy, obviously is a disease of the heart muscle, the myocardium. And it's usually affects younger kids, and we do tend to see it with people who play sports. So C is correct. Again, the myocardium becomes hypertrophied, so that thick muscle, harder to pump blood, and again, they have trouble doing some sports. But shortness of breath, chest pain, arrhythmias, again, dizziness, fainting, all contributing things that we'd want to know as soon as possible. Priority goal for someone with cardiomyopathy, what is the goal? The ultimate goal. Question? No. So the ultimate goal for someone with cardiomyopathy is really we want to maintain cardiac output. We want to improve it, but if not, want to maintain it. Let's see, cardiomyopathy, again, could lead to heart failure. Sodium is a major electrolyte involved and can lead to heart failure. Client is being discharged after a heart transplant with a prescription for cyclosporine. What priority education does the nurse provide with the client's discharge instruction? A, use a soft bristled toothbrush and avoid flossing. B, avoid large crowds and people who are sick. C, change position slowly to avoid hypertension. D, check your heart rate before taking the medication. So a lot of times you want to slow down when you're doing questions, because I'm reading them pretty quick. But when you're doing questions, you want to say, why did they take cyclosporine? To prevent rejection. It's autoimmune. It's going to bring down their immune system so they don't reject it. So some of them who are bringing down the immune system, they're at risk for infection. So they're not at risk for bleeding. This would be thrombocytopenia. So yes, B is correct. That's, again, we're going to prevent rejection of the heart transplant.
B for boy.
What was that?
I was asking, is B for boy? B?
Yes, B for boy. Sorry. All right, the nurse is assessing a client with a history of heart failure. What priority questions assist the nurse to assess the client's activity level? Again, really understand what it's asking. Heart failure, how do I know what their activity level is? So, do you have trouble breathing or chest pain? Are you able to walk upstairs without fatigue? Do you awake with breathlessness during the night, or do you have a new onset heaviness in your leg? What did you say?
B.
B is the only one that really contributes to activity level. So really make sure you know exactly what the stem of the question is asking. The nurse assesses a client with left-sided heart failure, so left lung. What condition does the nurse assess for? Select all that apply. So true or false? Pulmonary crackles, true or false?
True.
Yes. Confusion, restlessness, true or false? True. Hypoxemia, again, they're O2 sat, so that's going to be true. Fluid volume overload, they're going to have changes in mental status. Pulmonary hypertension.
Sure.
No.
Pulmonary
They're not going to have pulmonary
Pulmonary
hypertension.
hypertension.
And pulmonary congestion, but not pulmonary hypertension. The stenosed valve could lead to pulmonary hypertension. Dependent edema, this is the lungs. False. S3, S4 summation gallop. True. So with left-sided heart failure, you do have an S3, S4 summation gallop. Cough worsen at night. Yes, true. So A, B, E, and F are correct. All right, so let me just throw out a couple other, someone who has pain in the jaw, back, shoulder, shortness of breath, nausea, diaphoresis, what's going on? Heart attack, angina, could be myocardial infarction. So we have diagnosed myocardial infarction. How are we treating it? Mona, morphine, oxygen, nitrate, aspirin. Why do we give somebody post-myocardial infarction aspirin? To prevent another heart attack. It's a platelet aggregate, so an antiplatelet aggregate. So again, to decrease the likelihood of blood clotting. So angina, well, how do we treat angina?
Nice.
Nitro. Nitroglycerin, sublingual, we put under the tongue. So the pain, they still had pain with rest, we gave them nitro. The pain went from an 8 to down, almost gone, but they're still saying it's a 3. Do we give a second one?
Yes.
Yes, we're going to give a second one if they still have any type of pain. Coronary artery disease risk factors that can be controlled. So hyperlipidemia, yeah, high cholesterol, hypertension, smoking, diabetes, sedentary lifestyle, absolutely. All those those things that can be changed, their diet. So we're going to do a cardiac cath, and we're going to have a contrast dye. What am I concerned about? Allergies. Allergies to what? Shellfish. Very good. So my cholesterol The nurse said she looked at my cholesterol readings and I am at increased risk for heart disease. What did she see? What is high and what is low? My LDL, if I'm
is
at
high.
increased risk, is gonna be high,
HDL is low.
and my HDL is gonna be low, because I want them the opposite. So, again, it can be just confusing the way it's thrown out. Cardiac cath, where do we typically do a cardiac cath? Where's the insertion site?
Left
The
femoral.
femoral artery. So post-procedure, what are my key things that I want to assess?
Distal pulses.
Distal pulses, I want to look for bleeding. So, but again, those pulses are going to be key. Color, temperature, pulse, and the affected extremity. So again, those neurovascular changes. Why do I draw cardiac enzymes when someone comes in and they have all those symptoms that I just said? Pain, jaw pain, shoulder pain. So we want to see if the myocardial muscle is even affected. So the cardiac enzymes are going to tell us if there's a degree of damage to the myocardium. So let's see. Okay, so I think that's it for cardiac right now. I'll be sending you more questions, but evidence-based practice, why do we do it? Why do we even care as nurses what evidence-based practice is? So say it again?
See if something really works.
We want to see if something really works. We want to increase quality. We're concerned about quality and safety for patients, so we want to make sure something works and it's backed by evidence. So for leadership, you're going to apply to a job. What type of leader do you want as your manager? Democratic. What's laissez-faire?
They don't care.
Just let things go, they don't handle any issues. What is authoritative leadership?
Make their own rules.
Too bossy, rules with an iron fist. Quality improvement. Why do we have continuous quality improvement in healthcare? To increase quality, is that what you said? Absolutely, that is the reason. For quality improvement, we want to increase quality. All right, so I will go over these again on, I forget that Friday that I put down there, the 2nd. I'm available on the Saturday. If people can't and want time, I can make time on that Sunday. My goal is to get 100% of you out of here, because then I'm working every Wednesday night with the 2020 for NCLEX review, and I'm here on Saturdays. So I'm here with you the whole step of the way. So you're gonna get through this course, you're gonna get through the NCLEX, and you're gonna pass it the first time. I'm gonna send you questions the week of Memorial Day. On Memorial Day itself, I'll be on the plane. I always do work on the plane. What's your area you want the most questions?
Cardiac.
Cardiac is 75%. I don't have questions, but I do get the blueprint. So I know clearly that most of this test is cardiac. So I will give you cardiac. Anything in cardiac in particular? Everything.
Cardiac.
So I'll just randomly do cardiac questions. All right, guys, thank you.
Thank you.